Hello and welcome back. You've heard a lot about behavioral treatment and behavioral intervention and evidence-based treatments for autism. As you know by now, it's all based on ABA, or Applied Behavior Analysis. In this video, we're going to talk about 5 things you should know about ABA. Before we start, remember that behavioral intervention based on ABA is the treatment for autism that is recommended by the American Academy of Pediatrics and the United States Surgeon General. ABA is based on the science of behavioral psychology. Behavioral psychology focuses on behavior that can be seen and documented. Traditional psychology focuses on what an individual may be thinking, which cannot be seen. Later in this program, you're going to learn about specific behavioral intervention techniques based on ABA and see demonstrations to help you put them into practice. Right now, we're going to quickly cover the 5 things you need to know about ABA. Number 1, ABA for autism isn't a one-size-fits-all program. A professional behavioral therapist trained and certified in ABA will develop an individualized plan for the specific needs of each child. In all cases, however, they will measure the child's observable progress learning specific skills, such as making a snack or using words. The behavioral therapist will chart these observations and results to clearly see what is working and what is not. ABA can improve children's communication skills, sharpen focus and attention, and develop social skills. It is a fully customizable approach that allows therapists to be creative and adjust to the needs of the child, which increases the possibility of bringing about meaningful, positive change. Number 2, progress is measured over time. When a child with ASD first begins a behavioral treatment, his or her therapist will identify individual goals. Therapists typically begin with simple, manageable goals and then move on to more complex goals. As the treatment plan progresses, therapists record specific results or data which they share with other advisors as well as with parents and caregivers. The data shows the therapist and parent how well the child is progressing and how and when adjustments should be made to the treatment plan. Consistently monitoring children's progress is a key factor in ABA's success. As their needs fluctuate, a child's treatment plan is adjusted. Number 3, learning happens everywhere. Although parents and caregivers may bring a child to a clinic or they may get therapy services in their home, it's important to know that learning happens everywhere and all the time. This is a crucial part of the ABA philosophy. Children can perform a task or skill with the support of their therapist and should then practice their newly acquired skills in a variety of different environments. Going out into the real world, like the library, the playground, or a restaurant, gives children the chance to transfer their new skills to real life. This is what's known as generalization, and it's a very important part of success. Parents are absolutely crucial to the success of an ABA or behavioral intervention program because they spend more time than anyone with their children and they know their children better than anyone else. Parents and caregivers must understand the skills their children are learning and should help the child generalize those skills. Number 4, ABA is not about punishment. Boiled down, ABA rewards preferred behaviors and gives consequences for undesired behaviors. However, some people misunderstand what consequences means in this context. It is especially important to understand that ABA for Autism is not about punishing children with autism when they demonstrate undesired behavior. The ABA behavioral intervention system of rewards and consequences aims to promote appropriate and cooperative behaviors and decrease harmful and detrimental behaviors. ABA therapists often use positive reinforcement to reward desired behaviors, but consequences might simply be the withholding of that positive reinforcement or reward. Learning within the ABA environment should be positive and enjoyable, helping children want to learn and grow. Finally, number 5, parents drive ABA home. Parental involvement in ABA therapy is absolutely critical to its success. Sharing insights on the behaviors, triggers, responses, and preferences of your child will enable your child's therapist to create an effective treatment plan and guide adjustments to the treatment plan ongoing. Parents have a great opportunity to help their kids generalize the skills they're learning. Parents are in the best position to expose children to real-world situations in which they can apply their newly developed skills. Many ABA therapy programs offer regular sessions for parents, during which time they train parents to support their children's learning and skills at home.